Hey guys, it's Bobby. I just want to take a few minutes to kind of come at you live here with an interactive discussion board post rather than writing a whole bunch of my thoughts, which some of you may or may not enjoy reading. With that being said, this week's discussion board post talks about kids who are at risk, right? This could be infants, children, adolescents, juveniles, however term you want to put that, but basically kids who are at risk. Are there services that should be offered to children and to some children and others not, and why? First, just on the discussion board, guys, please make sure you're adding a lot of detail and thought and citing sources. It should be more than a few sentences. Really, this is an entire concept that you could take pages on, really. So a few paragraphs is more likely what I'm looking for. With it being said, one of my areas of expertise is looking at risk and protective factors of kids, and juveniles especially. When we look at risk factors, we're looking at basically the equation of variables: family, environmental, genetic, biological, however terms you want to put it. There's a lot of different ways at looking at it. But what we're looking at is what are some things that kids are bringing to the table that puts them more at risk for certain things. Obviously, I saw ADHD mentioned there, but we're looking also at abuse, neglect. We're looking at, mental health concerns. We're looking at behavioral disorders. We're looking at issues at school in terms of learning disabilities. We're looking at bullying, whatever kinds of things that kids struggle with. What are the risk factors of this? So absolutely, services should be offered to some kids and not to others. We use really effective screening tools to determine what are some challenges that kiddos may experience, what are their strengths, and what are their challenges. And then what we call strengths are protective factors. So what are the things in place that reduce the risk? The risk of them developing a behavioral disorder, the risk of them developing delinquency, the risk of them, engaging in early sexual activity or drug use. What are the things that are in place that are going to reduce that fact, such as good parenting, a stable social environment, a strong school, positive peer supports, parents who have an education, all of those risk and protective factors we look at. We also want to talk about services. If we're going to pick an area of risk, what are some things that we maybe would put in place? You brought up the idea of ADHD, for example. So we would start looking at environmental factors, genetic factors, putting them all into play, doing some screening, and then having a discussion with the parents to determine what are we looking at? What does the school environment look like? What does the home environment look like? What does the kiddo function best at? What are some risk factors that if we don't deal with ADHD, some things that may grow into larger issues? So really, this is a pretty inclusive topic. What we do in social work is looking at risk factors, to be honest. We look at that in terms of prevention. We look at it in terms of reaction, responding to a crisis, and we look at it in sort of settling a crisis and then responding to the families that we work with. The term at risk basically means someone who is potentially going to develop or experience the particular issue we're looking at. So if we look at abuse and neglect, what are some kiddos who are at risk? Kiddos who are in poverty, single parent homes, environmentally, so high areas of crime and drugs, lack of parental education, lack of support for parents, previous history of abuse and neglect for parents, incarceration, drug concerns, mental health issues. All of those things put children at risk. So when we know those things are present with a family, we want to intervene. We want to reduce the risk of mental health, drug, crime, poverty, all of those things that contribute to abuse and neglect. Now keep in mind, I listed all of these things, but just because a kiddo is in an environment where the parents are poor or they're uneducated or it's a single parent home does not mean they'll be abused or neglected. They're just risk factors. It means they're at a greater risk than a child who comes from a two-parent home where the parents are educated, they have a good support system, they are regularly involved in the kids' lives. Just things look a little bit different. It doesn't mean that child won't be abused or neglected. It means there's just a less likelihood. That's really the balance of risk factors and protective factors. It's saying this child is more likely to experience this particular problem. We're going to intervene here. We're going to assess. We're going to use various tools. Then we're going to reduce the risk by adding protective factors. Hopefully that makes a little bit more sense when we kind of break down the concepts. But that's what I'm looking for here on the discussion board, are specific examples of what that would look like. Some things to use obviously are abuse and neglect, mental health concerns like you talked about, ADHD, but break that down a little bit more. What are the kiddos that are more likely to experience that? Parents who have ADHD, is one of the greatest contributing factors. Early childhood experiences, temperament. They're looking at birth trauma as a possible maybe mitigating circumstances. Now again, just because a mom or dad has ADHD doesn't mean the child will get it. It just puts them at risk. That's really what we're trying to determine here. So I want to make sure you guys understand what that looks like and how it means to apply these concepts. So hopefully that helps. I'd love to hear your thoughts.